everyone. I'm Secretary Michelle Branham. On behalf of the Florida Department of Elder Affairs, I would like to welcome you to this presentation. As you may be aware, Florida has more than 580,000 people living with Alzheimer's, and this number is expected to increase over the next several years. To meet the growing need, I'm thrilled to introduce the training as part of our effort to increase awareness and knowledge of dementia. By growing our understanding of the most common forms of dementia, identifying the signs and symptoms, and improving our skills for communicating and interacting with persons with Alzheimer's disease and other forms of dementia, we will be providing the highest quality of care to our beloved Florida seniors. Thank you so much for the work that you do, and thank you for your dedication to improving the lives of Floridians.
Thank you, Secretary Branham, for getting us started. My name is Keith Gibson, Florida's Diversity and Inclusion Director at the Alzheimer's Association. Right now, more than 6 million Americans are living with Alzheimer's disease, supported by more than 11 million unpaid family caregivers. To bring this closer to home, there are more than 580,000 Floridians estimated to be living with Alzheimer's. They are supported by more than 827,000 unpaid family caregivers. The reality is that most of us know someone who's experiencing Alzheimer's or other dementia. They are our mothers and fathers, our grandparents, neighbors and friends, sometimes even our adult children. This isn't just their fight, it's everyone's fight. It is important to note that some of us are more at risk. Women are at the center of the Alzheimer's epidemic. Almost 2/3 of Americans diagnosed with Alzheimer's are women, and 60% of caregivers for individuals with Alzheimer's are also women. In addition, Black Americans are twice as likely, and Hispanic Americans are 1.5 times more likely than white non-Hispanic Americans to have Alzheimer's. Adults with Down syndrome are also at an increased risk for Alzheimer's, with a younger onset and faster progression.
Hi, I'm Heike Corsi, Bilingual Program Manager at the Alzheimer's Association. Let's go inside the brain to better understand how it works. Your brain is your most powerful organ. It has a similar texture to firm jelly. Your brain has 3 main parts: cerebrum, cerebellum, and brainstem. The cerebrum fills most of your skull. It is involved in remembering, problem solving, thinking, and feeling. It also controls movement. The cerebellum sits at the back of your head. It controls coordination and balance. The brainstem connects the brain to the spinal cord and controls breathing, digestion, heart rate, and blood pressure. You may have heard the saying, "What is good for your heart is good for your brain." Your brain is nourished by one of your body's richest networks of blood vessels. With each heartbeat, arteries carry about 20 to 25% of your blood to your brain, where billions of cells use about 20% of the oxygen and fuel your blood carries. When you are thinking hard, your brain may use up to 50% of the fuel and oxygen in your blood. The whole vessel network includes veins and capillaries in addition to arteries to help make your brain's supply lines. Your brain is divided into two halves. Experts are not certain how the left brain and right brain may differ in function. In most people, the language area is chiefly on the left side. The left half also controls movement of the body's right side. The right half of your brain controls the body's left side. This is important to understand. If someone has a stroke on their left side, you will see the effects on the right side of the body. The cortex is known as the thinking wrinkles. Your brain's wrinkled surface is a specialized outer layer of the cerebrum called the cortex. Scientists have mapped the cortex to identify areas strongly linked to certain functions. Let's take a closer look at the cortex. This area interprets sensations from your body. This area processes what you see. This area processes sound. This area processes smell. This area processes your thoughts, problem solving, and planning. This area helps you to form and store your memories. This area controls your voluntary movements. Knowing how the senses are processed allow us to use multiple areas of the brain when communicating with someone who is experiencing cognitive impairment, such as Alzheimer's. When communicating with someone experiencing Alzheimer's or dementia, we want to communicate using as many of the senses as possible. We will discuss this more a little later. Neurons are the chief type of cell destroyed by Alzheimer's disease. An adult brain contains about 100 billion nerve cells. Branches connect the nerve cells at more than 100 trillion points. Scientists call this dense branching network a neuron forest. Signals traveling through the neuron forest form the basis of memories, thoughts, and feelings. The real work of your brain goes on in individual cells. The neurotransmitters travel across the synapse, carrying signals to other cells. Scientists have identified dozens of neurotransmitters. Alzheimer's disease disrupts both the way electrical charges travel with cells and the activity of neurotransmitters. Signals that form memories and thoughts move through an individual nerve cell as an electrical charge. Nerve cells connect to one another at synapses. When a charge reaches a synapse, it may trigger release of tiny bursts of chemicals called neurotransmitters. Consider this: 100 billion nerve cells, 100 trillion synapses, dozens of neurotransmitters. This strength in numbers provides your brain's ability to function. Over time, our experiences create patterns. These patterns of activity explain how our brains process our thoughts, memories, skills, and a sense of who we are. This is an example of a PET scan, or positron emission tomography scan. It shows typical patterns of brain activity. Here we see the area of the brain associated with reading words. This area is associated with hearing words. This area is associated with thinking about words. And this area is associated with saying words. Our brains are amazing and complex. Now you know the basics about how our brains work. I'd like to invite Keith back to tell us more about the effect of Alzheimer's and other dementias on our brain.
So let's start with one of the most commonly asked questions. What is the difference between Alzheimer's and dementia? Dementia is not a disease, but rather a term to describe a collection of symptoms related to abnormal brain changes. Dementia symptoms cause a decline in cognitive skills such as memory, thinking, and behavior. They can also affect feelings and relationships. Dementia symptoms impair daily life and the ability to live independently. Sometimes the cause of cognitive decline can be due to other conditions such as an infection, vitamin deficiencies, medication interactions, or other health conditions. It is important to talk to a healthcare provider about any new symptom. This will allow them to accurately diagnose what is going on with the brain and body. There are many causes of dementia. Let's explore the top 5. Alzheimer's is the most common cause of dementia, accounting for 60 to 80% of all cases. It is a progressive disease where symptoms start out slowly and gradually worsen over a number of years. In its earliest stages, memory loss is mild, but as the disease progresses, individuals lose their ability to carry on a conversation and respond to their environment. On average, a person with Alzheimer's lives 4 to 8 years after diagnosis. However, people can live as long as 20 years depending on other factors. How much does your brain weigh? Our brains weigh about 3 pounds. As Alzheimer's progresses through the brain begins to shrink. By the late stages of the disease, a person's brain could shrink by up to a third, affecting nearly all brain functions. The majority of people with Alzheimer's are 65 and older. If a person under 65 is diagnosed, it is called younger onset Alzheimer's. Younger onset Alzheimer's is much less common. People living with it and their families face unique challenges. Care partners may have to return to work, increase their hours, or get another job to make up for the loss of income. And still, they continue to take care of family responsibilities. This is especially true if the person living with the disease worked at a job that provided most of the financial support for their family. Many of these care partners still have children at home and face increasing costs associated with raising a family.
I am 66. I was diagnosed when I was 65.
I was diagnosed initially in November of 2015, and I think I'm getting the dates right. Part of my issue is my dates sometimes mush together.
I know exactly what we're doing. I know you're Steve. I know you're Zach. We're here in Pine Street finally.
On July 20th of last year, I received the official diagnosis with 17 research physicians and doctors in the room, myself, my husband, and my 2 children with the diagnosis of early onset, early stage Alzheimer's.
And you can take a minute to...
Every time I say it.
The way I explain it to people is I am in a new life. My former life no longer exists, and it's up to me to create a new life.
I knew something was wrong. It's not normal to not be able to calculate a tip anymore. It's not normal to not do math in your head and to be able to subtract or add numbers. It's not normal to not remember conversations or to attend a training class and not remember what was taught.
More and more words are going away, and there are a number of words that no matter how I remember them, they are not there. You know, I can say, okay, now I've got it, and two minutes later, I won't have it.
With Alzheimer's, you don't have an option. It's just not there. The information is just gone.
It seems to be particularly difficult for those of us with Alzheimer's early onset to have, sorry, I got a little bit. Okay, where was I?
Frustrating is the word that comes to mind. I am frustrated with the fact that I don't know what 32 minus 7 is without a pen and paper. It frustrates me that I have no idea what today is, but I do know it's Friday.
First thing I lost was my car. So I was no longer able to use my car for various reasons. I got a bicycle, and I've had 2 crashes with that. And I think part of that is spatial.
Now I have a new job, and that job is to be loud and proud about my disease, to share my symptoms with everyone and anyone who will listen to me.
I'm able to be useful. I'm able to surround myself with a lot of people, which is absolutely the most important thing you can do with Alzheimer's.
Everyone always tells me I look good. Well, what does that have to do with anything? I keep saying to people, I'm going to walk around in a bathrobe with a towel on my head, no makeup, just an old hag. And then maybe they'll think I have Alzheimer's. But this is what Alzheimer's looks like. It looks like me.
My name is Chris Hannafin.
My name is Pam Montana. And this is my brief but spectacular take.
Brief but spectacular take.
On living with Alzheimer's.
Vascular dementia is the second most common cause of dementia and refers to changes to memory, thinking, and behavior. These changes come from conditions that block or reduce blood flow to the brain. Inadequate blood flow deprives the brain of oxygen and nutrients. This can damage and eventually kill brain cells. Controlling conditions that affect heart health and improve blood flow can slow the disease progression. Dementia with Lewy bodies is a type of progressive dementia. The most common symptoms include changes in thinking abilities, movement, sleep, and behavior. The degree of symptoms can vary widely, and people with this disease may not have every symptom. Common symptoms include trouble with attention, planning, multitasking, problem solving, and reasoning. Other symptoms include slow movement, tremor, or rigidness. A person with dementia with Lewy bodies may see things that are not there, resulting in recurring visual hallucinations. People experiencing this type of disease may act out their dreams. This is known as rapid eye movement sleep behavior disorder. Evidence suggests that dementia with Lewy bodies, Parkinson's disease, and Parkinson's disease dementia are linked to the same underlying abnormalities in the brain. Parkinson's often starts with a tremor in one hand. Other symptoms are slow movement, stiffness, and loss of balance. Parkinson's disease dementia is an impairment in thinking and reasoning that eventually affects many people with Parkinson's. People diagnosed with Parkinson's disease dementia may experience movement symptoms like hunched posture, rigid muscles, a shuffling walk, and trouble initiating movement. The fifth most common type of dementia is frontotemporal dementia, also called FTD. FTD is a group of disorders caused by progressive nerve cell loss. This can occur in the brain's frontal lobe, which is the area behind your forehead, or it can happen in the temporal lobes, which is the area behind your ears. FTD causes deterioration in behavior, personality, and/or difficulty with producing or comprehending language. Age at this diagnosis may be an important clue because most people with FTD are diagnosed between the ages of 40 and their early 60s. Behavior changes are often the first noticeable symptoms. FTD is inherited in about 1/3 of all cases. Now that we have discussed the top 5 causes of dementia, we need to note that mixed dementia is also prevalent. Mixed dementia means that you can experience more than one disease process at the same time. Though it is not known how many people have mixed dementia, autopsies indicate that the condition may be more common than previously realized. Tremendous gains have been made in the understanding of the science and basic biology underlying Alzheimer's and other dementias. It is important to note that symptoms can be inconsistent. One does not need to experience all the symptoms in order to receive a diagnosis. Scientific advances are leading to great strides in risk reduction, detection, diagnostics, and therapeutic interventions. When we talk about Alzheimer's disease being a continuum, this means the changes are happening over time. Everyone will start off without symptoms. Some of us may develop mild cognitive impairment, also called MCI. Now, MCI does not affect activities of daily living, but there are noticeable changes in the brain that can be measured. Not everyone with MCI goes on to develop Alzheimer's. However, those who continue to progress are diagnosed with MCI due to Alzheimer's. As the person continues to progress, they will pass through additional stages, including the mild, moderate, and severe stages of the disease. An important point and something to remember is that brain changes from Alzheimer's may begin 20 years or more before symptoms appear. This provides all of us with an opportunity to reduce our risk of developing Alzheimer's disease. Biomarkers are helping to shift our understanding and really detect this disease at its earliest time points. A biomarker is a tool used to detect that something is happening in the body, such as a disease. You may be familiar with biomarkers already. For example, with diabetes, a blood sugar test is used to detect blood sugar levels. Another type of blood test is used to detect cholesterol to better understand the risk of heart disease. Like diabetes and heart disease, there are biomarkers to detect Alzheimer's. Over the past few years, we've seen a lot of research focused on developing new biomarkers for Alzheimer's and other dementias. What if one day you were able to walk into your doctor's office and receive an FDA-approved eye scan or a blood test that could give some indication of your risk for developing Alzheimer's disease? Now, that sounds quite futuristic, but there are scientists that are working on these types of approaches right now. Up until recently, the only treatments available helped manage the symptoms of Alzheimer's for a limited time. They did not treat the underlying cause of the disease. Because each person experiences Alzheimer's differently, these treatments work to varying degrees and are not effective for everyone. Now we have a new story of hope. Welcome to the new era of treatment. We have worked for decades to get to this moment. More time to live, to love, and make more precious memories. The first anti-amyloid treatment was approved in 2021, and a second one was approved in 2023. These treatments are different because they slow down the disease progression by targeting the underlying biology of the disease. Today, there are over 140 unique therapies being tested in clinical trials to address the biology of Alzheimer's. There's unlikely to be one single solution that's going to be able to treat Alzheimer's effectively. For example, we could treat Alzheimer's like we do cancer or cardiovascular disease, a combined approach of multiple effective treatments along with other types of approaches like risk reduction strategies. Based on the research that we're seeing around the world, we know that there are things that may influence our risk. Some we can change and others we cannot. A risk factor that we cannot change is our age. Alzheimer's and dementia is not normal aging, yet age is the biggest risk factor for developing Alzheimer's. Another risk factor we cannot change is our genes. We know that race, ethnicity, and sex play a role, but we're still learning more. Risk can be different depending on your own personal factors and the type of group or population you belong to. We also know that access to healthcare or education may influence some or all of these risk factors. Research has shown that we need to study risk from all angles, including across different populations. But there are things you can do now. Growing evidence indicate that people can reduce their risk of cognitive decline by adopting key lifestyle habits such as exercising, socializing, and taking care of your mental health. As you can see on your screen, there are 10 action steps that support brain health. When possible, combine these habits to achieve maximum benefit for your brain and body. Start now. It's never too late or too early to incorporate these healthy habits.
In healthy people, all sensations, movements, thoughts, memories, and feelings are the result of signals that pass through billions of nerve cells or neurons in the brain. Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves two proteins, called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate. As neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. People may begin to experience memory loss, impaired decision-making, and language problems. As more neurons die throughout the brain, a person with Alzheimer's gradually loses the ability to think, remember, make decisions, and function independently. Achieving a deeper understanding of the molecular and cellular mechanisms and how they may interact is vital to the development of effective therapies. Much progress has been made in identifying various underlying factors. Advances in brain imaging allow us to see the course of plaques and tangles in the living brain. Blood and fluid biomarkers are providing insights about when the disease starts and how it progresses. More is also known about the genetic underpinnings of the disease and how they can affect particular biological pathways. These advances enable the development and testing of promising new therapies, including drugs that reduce or clear the increase of tau and amyloid proteins in the brain, therapies targeting the vascular system, glucose metabolism, and inflammation, and lifestyle interventions like exercise or diet, and behavioral approaches like social engagement that may enhance brain health. Research is moving quickly, ever closer to the day when we can delay or even prevent the devastation of dementia.
Next, we are going to review the warning signs of Alzheimer's. Let me introduce Alzheimer's Association community educator, Sophia Sundberg, who works at the USF Memory Disorder Clinic.
Let's take a look at the 10 warning signs. The first is memory loss that disrupts daily life. This means forgetting recently learned information. They may forget important dates or events. They might ask the same questions repeatedly. They could increasingly rely on memory aids, such as reminder notes, electronic devices, or family members for things they used to handle on their own. Consider making a grocery list, going to the store and realizing that you left your grocery list at home. You can recall some of the items on your list, but not all. You also add items that were not on your list. Once home, you see your grocery list in your own writing. You do not remember ever having made the list. The second is challenges in planning or solving problems. Some people living with dementia may experience changes in their ability to develop and follow a plan or work with numbers. They may have trouble following a familiar recipe or keeping track of monthly bills. They may have difficulty concentrating and take much longer to do things than they did before. Consider the best cook in your family. Suddenly, their famous recipe does not taste the same, as steps were missed. This is not normal for your family member. The third is difficulty completing familiar tasks. People living with Alzheimer's disease often find it hard to complete routine tasks. Sometimes they may have trouble driving to a familiar location, organizing a grocery list, or remembering the rules of a favorite game.
Okay, Dad, look at you.
I look nice, don't I?
I see you.
Yeah.
Adding your own flavor to fashion comes with age.
Let's go.
Oh man, that's the best one yet.
Forgetting how to add doesn't. Finding it difficult to work with numbers may be a sign of Alzheimer's.
Dad, are you okay?
An early diagnosis can help improve the quality of life for your loved one.
High school. Yeah.
Hey, Dad. Do you want to talk about what happened earlier?
Learn the warning signs of Alzheimer's. Some things come with age, some others don't.
The fourth is confusion with time or place. People living with Alzheimer's can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it is not happening immediately. Sometimes they may forget where they are or how they got there. A cause for concern is when Dad does not come to Sunday dinner on time when this is a family tradition. Also, consider a detour after a storm. This is often when we will see Floridians getting lost, as they are not able to travel the same roads they always do.
Losing the fear of looking foolish comes with age.
Who did you steal him from?
Losing your way in your own home doesn't. Confusion with time and place may be a sign of Alzheimer's.
Mom, are you okay? Yeah, I'm fine.
Early detection gives you and your loved one time to plan for the future. Learn the warning signs of Alzheimer's.
The fifth is trouble understanding visual images and spatial relationships. For some people, vision problems are a sign of Alzheimer's. This may lead to difficulty with balance or trouble reading. They may also have problems judging distance and determining color or contrast. This can cause issues with driving. It can also be difficult for some to understand shadows, shine, and color. A shadow can look like someone hiding in a corner, and a shiny floor can look like a flood. The color black can often look like a hole. The sixth is new problems with words in speaking or writing. People living with Alzheimer's may have trouble following or joining a conversation. They may stop in the middle of a conversation and have no idea how to continue. They may also repeat themselves, struggle with vocabulary, have trouble naming familiar objects, or use the wrong name for a person or object. The seventh is misplacing things and losing the ability to retrace steps. A person living with Alzheimer's may put things in unusual places. They may lose things and be unable to go back over their steps to find them again. They may accuse others of stealing. The eighth is decreased or poor judgment. Individuals may experience changes in judgment or decision-making. For example, they may use poor judgment when dealing with money, or pay less attention to grooming or keeping themselves clean. The ninth is withdrawal from work or social activities. A person living with Alzheimer's disease may experience changes in the ability to hold or follow a conversation. As a result, they may withdraw from hobbies, social activities, or other engagements. The last warning sign is changes in mood or personality. Individuals living with Alzheimer's may experience mood and personality changes. They can become confused, suspicious, depressed, fearful, or anxious. If you notice any of these 10 warning signs of Alzheimer's in yourself or someone you know, don't ignore them. Schedule an appointment with your healthcare provider. Please know that it's possible for individuals to experience one or more of these signs in varying degrees. It's not necessary to experience every sign in order to raise concern. It is important to get a medical evaluation to determine the cause. The diagnostic process will vary from person to person, depending on an individual's specific situation and what the doctor feels is the right course of action. It can be helpful to understand the type and purpose of the tests your doctors may order, and knowing what to expect during an evaluation can help to ease anxiety. Assessments may include medical history, physical exam, screen for depression, and an interview with a close companion. Tests may include laboratory tests, mental cognitive status tests, brain imaging, and cerebrospinal fluid, or CSF, analysis. An early diagnosis allows people time to make planning decisions and to be part of the decision-making process with their families. It allows time to access care services earlier and participate in clinical trials. We know that clinical trials play an important role in finding treatments and potentially a cure for Alzheimer's and other dementias. We also know that participating in a clinical trial has many benefits. This can include maximizing healthcare and the ability to receive one of the FDA-approved treatments.
For every human being, life is like a river. The constant flow of water represents our daily experiences, from routine and familiar to those that take us by surprise. If we're lucky enough to live a long life, we'll experience the river in each of the 4 seasons: spring, summer, fall, and winter. Spring is early childhood, when the river is new to us and we're just learning about all the fish, birds, and animals that connect with it. Summer is our experience from childhood to adulthood, when we transition from relying on others to navigating the water and harvesting for ourselves. Fall is adulthood, when we know the river and its resources and dangers well enough to provide for others, raise children, and chart our own course in the world. Winter is elderhood, when we've acquired the deepest knowledge and wisdom, but also start to experience changes from the aging of our bodies. Dementia is like navigating a river freezing in a long winter storm or even a blizzard. Storms can come in any season, although they're most common and most severe in winter. The wind and snow make it harder to see and hear the water. Everyday life, the natural flow of the water becomes harder to navigate. Thinking activities that used to be easy, like planning a fishing trip, buying bait, planning meals for the trip, and reaching out to others to join the activity, become increasingly difficult. However, even at the start of a winter storm, emotional experiences and feelings remain strong. For example, the love of fishing, the memory of the sunlight bouncing off the rippling current, and the joy of company. The longer a person lives with dementia, the thicker the ice on the river can become. The everyday flow of experiences beneath the surface is more difficult to reach and navigate without help. Eventually, even deep and lifelong emotional and spiritual connections are harder to access through the thickening ice. This story of a river in a long winter storm helps explain the experience of dementia. Facts, recent memories, and complex thinking become harder to reach in the thickening ice, while deeper memories and emotions continue to flow under the surface.
Now that we understand a little more about the warning signs and the importance of early diagnosis, let's talk about communication and behavioral changes that a person with dementia may experience. Alzheimer's and other dementias gradually diminish a person's ability to communicate. Changes in the ability to communicate can vary and are based on individual factors, such as where they are in the disease process. Changes in communication that you can expect to see throughout the progression of the disease may include difficulty finding the right words, using familiar words repeatedly, describing familiar objects rather than calling them by name, easily losing a train of thought, difficulty organizing words logically, reverting to speaking a native language, speaking less often, and relying on gestures more than speaking. In the early stages, use these communication tips. Don't exclude the person with the disease from conversations. Try to include them. Avoid criticizing or correcting. Instead, listen and try to find the meaning in what the person is saying. It can help to repeat what the person has said to clarify. Speak directly to the person rather than to their caregiver or companion. Please give the person time to respond. Lastly, don't pull away. Your honesty, friendship, and support are most important. In the middle stage, continue to use the early stage communication tips. Then add in these additional tips. Approach the person from the front and identify yourself. Engage the person in one-on-one conversation in a quiet space with minimal distractions. Speak slowly and clearly. Maintain eye contact. Encourage nonverbal communication. Consider the feelings behind words or sounds. Emotions being expressed are more important than what's being said. Finally, please be patient and offer reassurance. In the late stage, it is important to continue to utilize communication tips from the early and middle stages. More so, focus on the 5 senses, which are a very important form of communication in this stage. Incorporate touch, sight, sound, smell, and taste into your daily interactions with the person with Alzheimer's or dementia. Above all else, always treat the person with dignity and respect. Here you can see many of the behavioral changes that people with dementia may experience. It's important to understand that although these can be challenging, the person is often expressing an unmet need. If it is a new behavioral expression, make sure to check in with your healthcare team members or a healthcare provider. If it is an emergency, call 911.
Right. It's not raining. Good. What? I've forgotten. Should I?
Just both sit down. Just both sit down.
Yeah. Right. Oh, that way. I don't. What? Oh. I don't know. Could you please? It's my list. Should I go? So I don't know quite what. Oh dear. Chicken cheese. What? Chicken cheese. Sorry. Oh. I don't know. People with dementia have experiences like this every day. A little bit of understanding, tolerance, and patience can make all the difference.
I'll tell you what, if you go into the seats just there,
Right.
when we get there, I'll call you, okay?
It's okay, madam. I can't get on.
Let me help you. This way.
Thank you.
Can I have a look at that list?
Yes.
Chicken and cheese.
Oh,
Let's go this way.
thank you.
It can be challenging to understand behavioral expressions. There are 5 tips that can help you to understand the unmet need or what the person is wanting to communicate to you. First, identify the immediate cause. Think about what happened right before the behavioral expression that may have caused it. Think about the who, what, when, where, and why behind the behavioral expression. Second, it is critical to rule out pain and other health conditions. Pain and other health conditions can cause a sudden change in the person's behavior. It is important to notify your team or healthcare provider when you identify these changes. Third, work to focus on feelings, not the facts. Validate the person's emotions rather than focusing on specific details. Look for the feelings behind the words or actions. Fourth, try not to get upset. Be positive and reassuring. Speak slowly and in a soft tone. Lastly, try to limit distractions by examining the person's surroundings. Once you understand the behavioral expression, use the recently learned communication tips. Here are a few more recommendations on how to respond to behavioral symptoms. Use a relaxing activity such as music, massage, or exercise to help soothe. Shift the focus to another activity. The immediate situation or activity may have unintentionally caused an aggressive response. Try something different. Take a break. If the person is in a safe environment and you are able to walk away, do so for a few minutes and then try to re-engage. Ensure safety. Make sure you and the person are safe. If the person is unable to calm down, seek assistance from others on your team. Always call 911 in emergency situations. Lastly, share your experiences and solutions with those on your team.
Thank you, Sophia. I'm Katie Fahrenbrook, Director of Community Engagement at the Alzheimer's Association. Caregivers, all caregivers, are heroes in every sense of the word. Caregivers wake up each day knowing that someone relies on them for vital care. They perform life-affirming tasks with compassion and love under the weight of tremendous stress. Caregivers and families need education and support. As one of our caregivers put it, it's hard to help a loved one who is confused when you yourself are confused about how best to help them. The role that caregivers provide in communities is critical. The task for caring for someone with dementia can be difficult. It can be especially difficult to balance caregiving responsibilities while working. Nearly 1/4 of caregivers are in the sandwich generation, meaning they care for an aging parent and children under 18. There are other work-related changes experienced by dementia caregivers. They go into work late, they leave early, or take time off. They turn down promotions, go from full-time to part-time employment, or even cut back their hours. Some even have to take a leave of absence or give up work entirely. Dementia caregivers frequently report experiencing high levels of stress. Though caregiving can be rewarding, it can also be overwhelming. Dementia caregivers can experience depression and anxiety, and women are more likely to experience the stress of caregiving. People can't go through dementia alone. It impacts the entire family. It takes a devastating toll on both the person diagnosed and caregivers. Because Alzheimer's and other dementias can last years to decades, caregiver stress and exhaustion can set in. This happens when caregivers put off taking care of their own needs. They skip medical appointments, sleep less, and ignore physical and mental health symptoms. Here, you can see 10 signs of caregiver stress: denial, anger, social withdrawal, anxiety, depression, exhaustion, sleeplessness, irritability, lack of concentration, and health problems. Whether you recognize these in yourself or someone else, knowing what to do to manage stress is important. The key is for caregivers to take care of themselves first. If someone is experiencing any of these signs on a regular basis, seek help. Contact your team leader, a doctor, or the appropriate person. As the disease progresses, new caregiving skills may be necessary. These can include learning to understand and cope with the behaviors and personality changes that often accompany dementia. You may also find it helpful to talk to coworkers and other caregivers about how they are coping with the challenges of caring for someone with the disease. Physical activity, in any form, can help reduce stress and improve overall well-being. Even 10 minutes of exercise a day can help. Find a relaxation technique that can quiet the mind and body. Some techniques include meditation, breathing exercises, yoga, or aromatherapy. Visit your doctor regularly. Try to eat well, exercise, and get plenty of rest. Your role is crucially important. Lowering stress can improve health and help make caregiving more manageable.
I had lost a lot of weight. I was getting headaches.
I felt my side go numb.
I developed chronic hives all over my body. I would lose my appetite.
I hit the floor.
My best friend referred to me as skinny, speckled, and sad. I would feel tension and tightness in my back.
I had collapsed after a particularly long day of caregiving.
As a caregiver for someone living with Alzheimer's, it's easy to put off taking care of yourself. But looking after your own health is not only important, it is critical. The Alzheimer's Association has resources to help. Recognizing the symptoms of caregiver stress is the first step to preventing burnout. Symptoms include depression, sleeplessness, irritability, and other mental and physical health issues. Just as each person's experience with Alzheimer's is unique, the ways you care for yourself can be too. Try different approaches to find what works best for you, like these caregivers.
As a caregiver, it's really important to build that deep bench of support, not only for your loved one, but also for yourself.
I would try to eat as well as I could, try to eat nutritious foods.
I found it extremely helpful to write stuff down. Keep a journal that celebrated those great moments.
Consider these tips to take care of yourself. Talk to a doctor if you're struggling with stress. Know you're doing your best. Get the support you need with Alzheimer's Association resources in your community.
It almost doesn't matter what you do, but do something for yourself to change the subject and get some relief.
To learn more about caregiver stress and tips to manage it, please visit alz.org/care.
We have covered a lot of information in this awareness program. Please know that there are community resources available to help. Many employers offer employee assistance programs that can be useful in obtaining resources. Also, there are 2 helplines that you should save on your cell phone. The Alzheimer's Association 24/7 helpline is 800-272-3900. It's available at no cost to answer questions, provide support, and assist with solving a difficult symptom. The QR code can be used to save the number to your phone. The second helpline is a statewide resource from the Area Agencies on Aging. The Elder Helpline is 800-963-5337. It can refer Floridians to financial assistance, respite services, and local community programs. In addition, if a care consultation is needed, referrals can be made to the Department of Elder Affairs Florida Center of Excellence Care Navigators. It is important for people experiencing cognitive impairment to have an accurate diagnosis and communicate regularly with their healthcare team. Alzheimer's and other dementias are complex diseases requiring symptom management. This is our network of memory disorder clinics around the state. If people need assistance with diagnosis, they can contact their own healthcare provider or reach out to one of the memory disorder clinics in their area. The Alzheimer's Association has some additional resources available at no cost. Learn more about these resources by visiting alz.org, calling the 24/7 helpline, or using this QR code. With these complex diseases, our work is never done. The ability to change people's lives lives in you. When a spark is lit, it is always there within you. There are so many ways to make a difference in the lives of people experiencing Alzheimer's and all dementias. We are the ones who can make an impact in our communities. Actually, we're the only ones. We will reach our vision of a world without Alzheimer's and all dementia. We like to say that the end of Alzheimer's starts with you and me and all of us working together. Thank you for taking the time to be with us today. Not only will you make an impact in your place of work, you will also make an impact in the community in which you live.